You're watching TVC Breakfast. Let's get into our next discussion. Nigeria is currently battling the third wave of the coronavirus, like many other countries around the world. The number of confirmed cases reported by the Nigeria Center for Disease Control daily is on the rise. The country has also begun to record deaths from COVID-19 complications, as experts say that the Delta variant of the virus is more deadly. But despite this, many Nigerians are still lax about COVID-19 prevention measures, and some stakeholders are now calling on the government to impose strict measures to curtail the spread of the virus. That will be the crux of our next discussion. Now, joining me in the studio is a clinical pharmacist and public health expert, Nsiabasi Ekanem. Nice to see you this morning. You're very compliant with Niger Delta, but you're not wearing the hat anyway.
I decided to keep that.
But it's good to see you.
Thank you very much.
Now, it is really a thing of concern to all of Nigerians that the numbers of COVID cases are rising. And not just that. The Delta variant, which is said to be more virulent and more deadly, is also marginally on the rise too, if you consider the numbers, over the weeks and all of that. What are we not doing, and what do we need to do differently?
Well, it's quite unfortunate, like I said some weeks ago, that the Delta variant of COVID-19 is actually coming at a time when there's already a pandemic fatigue in Nigeria. If you notice that a lot of Nigerians have laid down their guards, well, perhaps because of the fact that, Nigerians feel that just maybe COVID-19 is not actually deadly as it was painted to be initially. I mean, given the fact that, okay, compared with to other countries, we are not recording so much number of deaths. I mean, the mortality is quite low in this part of the world compared to the Western world. And unfortunately, the whole episode of the pandemic, the things that happened, the commitment from the public, from the private sector, the social sector, and even the way the information around the pandemic has been managed all through up to this time, many Nigerians really just feel that just maybe the pandemic wasn't such an issue for us in Africa. But the truth is that we are having daily, and we keep saying that the more the virus keeps spreading, the more new variants are going to develop. That's the basic science, basic medical sciences. And then because this mutation is still going on, we are going to have new variants, all right, even the more. Until we are able to contain the virus and contain the spread of the virus, we will definitely have new variants. So I think what is important for us is, how do we stop this? How do we nip this in the bud, so that at the end of the day we can contain the virus, and by so doing we would go ahead to reduce the probability of having new strains. Now we are having the Delta variant. This Delta variant is much more deadly, is much more virulent compared to other variants that we have in the past. Now there's a possibility that even the next one that may come out, if we are not careful, maybe even more much deadlier than the ones that we have here.
But basically, what leads to this variant that we always talk about here and there? What gives a rise to a new variant?
Well, it's just about mutation. Now, the principle, there's a principle in virology that states that when viruses multiply, when they replicate, there is often the chances of a mistake in copying the proteins. All right. When a virus is trying to replicate to form new viral particles, there's often the chance of a mistake, all right, in copying new viral particles. Now, that mistake all right, in the formation of the proteins that make either the DNA or the RNA, which is the nuclear structure of the virus, that mistake there would lead to the formation of a new variant, because the new variant will be different from the previous one because of that mistake. It could just be maybe misplacement of proteins in the DNA structure. It could just be more like, okay, the new variant is able to attach itself more, to the surface. It could probably be able to attach itself more to what we call the ACE receptors, where most viruses attach, particularly the SARS virus. So that mistake in copying the new protein leads to mutation. And as long as new proteins or new viruses are recopying itself or reproducing itself, there's bound to be that mistake, and of course, there's bound to be that mutation that leads to the new variant.
Wow. Wow, wow, wow. You've taken us to the lab this morning now. But it's good to have this idea so one can, be imaginative and then paint a vivid picture of how these things play out.
So that people will know that it is mathematical. If you stop the replication, you are going to stop the mistakes. You are going to stop the mutation, and you are going to stop having new variants of the virus. So that is basically the idea, and that is why we keep saying that, look, let us see how we can reduce or rather contain the spread. Once we stop the spread, we are going to have the possibility of having new strains will be far reduced.
Now, before we leave this issue of new variant, now we're having the Delta variant. How does that undermine or negate the issue of the vaccines that we have on ground already?
Well, the truth is that development of new variants continue to pose a threat to the available vaccines. And it's important. That's why it's important that we do everything possible, which, of course, stick to the public health measures as much as possible, so that we can cut the chain of transmission, so that we will not end up developing new strains that the vaccines that we have cannot take care of. Now, remember, a lot has been put in to develop these vaccines. Now, if we have new variants moving around, and these new variants are not responding to these vaccines, then it's going to pose a problem to us. But the good news is that for some of the vaccines that we have, there's some level of, though not up to 95% or 94% as it is with the previous strain, but there's some level of protection with the currently available vaccine, particularly the Pfizer, the Moderna, and I think the Johnson & Johnson that we have received. They are still very effective, but how far can we go? The more the replication, the more the variants, the lesser the ability of us being protected by the vaccine. And that's why there's need for us to reduce the replication and ultimately reduce the development of new variants, because it might really be a threat, to the vaccines that we have currently available.
All right. So ultimately, the formula for cutting off this new variant and ensuring we're safe remains the protocols.
Yes.
The constant or regular washing of hands with soap and running water, the using of face masks
properly
exactly, and then the issue of physical distancing.
Exactly,
all right.
It's very important.
Okay.
Coupled with the vaccine, all right?
So
it's actually a two-way strategy. Like we said, vaccine, social distancing, public health measures alone, I mean, like you've listed, may not just help us eradicate the virus, but we have a vaccine. But we need to have a combined effort. I mean, both the public health measures, that is a non-pharmaceutical, and the vaccine. If we combine both together, I can assure you that we'll soon see the end to this
Talking about the issue of the vaccines, a lot of people are still very skeptical about the issue of the vaccines with all of the, theories that the conspiracies that they nurture in their heads and in their minds and all of that. But what else can we do to bring people out to take the vaccine?
Okay, let me make something clear. I think there's a misconception about vaccines. All right, vaccines. The vaccine itself, right, that agent itself, does not last for a lifetime in the body of humans. What lasts for a lifetime is the antibody that's developed against the virus. You know, sometimes people say long-term effect, okay, maybe in the next 10 years, you are going to probably develop this and that. In the next 3 years, that vaccine is gone. In fact, in the next 6 months, the vaccine is gone, because this is what happens when the vaccine is administered, all right? This is what happens. The vaccine stimulates immune response, all right, by stimulating the production of specific antibodies. Now, those specific antibodies will now be, that is immunoglobulins, are the ones that will circulating around the human body. And that is what protecting you from the virus. And that is what will last for a lifetime. But the agent itself, the vaccine itself, doesn't last for a lifetime, all right? So it will be eliminated by the body. So there's no need for us to, this misconception that, okay, over the long period of time, the vaccine will cause this and that. It is not true. COVID-19 vaccines are very safe. We have seen a lot of persons that have taken the vaccine. Millions of people across the world have taken the vaccine. Hundreds of millions. And of course, we've seen that it is very safe, it's very tolerable. Some of the adverse events are well documented. And of course, you know, the World Health Organization is working with other multilateral organizations to make sure that we address any concern with regards to the vaccine. So there's no need for us to be scared, as a matter of fact. We have even had Nigerians who have taken the vaccines. Yeah. What has happened to them? Nothing. Now, I will tell you that, in the like I said, in 6 months' time, those vaccines are gone. What you have in the system are the immunoglobulins, the antibodies, which will keep circulating around the body and provide immunity for a lifetime. So there's nothing to be scared about the vaccine. Rather, what we should do is to make sure that we take the vaccine so that we can protect ourselves, and our families, and our loved ones against the
our country. All right. Now, some people have advocated that since people are not adhering to these protocols you talked about, or we were talking about earlier, it will be good for government to take some firmer or more stricter measures as a way of compelling the people to adhere to some of these things so that people are protected. Would you recommend that any other stricter measures will be taken by government?
Well, there's always what we call a stick and a carrot approach in handling, whether it's public health, whether it's any facet of life. I feel that at this time, I think we need to re-communicate back with the people. I could recall that at the time when, towards last year, between April and somewhere around July, August, Nigerians actually felt the heat of the pandemic. Now, let me tell you this. I lost a friend to COVID-19 last 2 weeks. I mean, it was very, very devastating, because this is somebody that had a very promising future. But she died due to COVID-19. Now, I think there's a need for us to bring this reality back. Let people know that people are still dying. No, but see, let me tell you, an average Nigerian is an intelligent person. An average Nigerian loves his or her life. He or she wouldn't want to die for something that is preventable. But there are ways of communicating with them, putting the picture bare so that they will know that, look, you may feel that COVID-19 is over, but people are still dying every day. We have lots of infection rates. I mean, the infection rate is going up, and we need to respond adequately. I think we need to communicate and then drive back that if you want to call it caution. Let them. Let's put this thing in perspective so that they will understand. All Nigerians will understand that it is not about enforcement. We are not enforcing it because we want you to do it. More like we want you to obey the law. But we are enforcing because we want you to be alive for us. We need you to be alive so that together as Nigerians, we can all go through this pandemic, and at the end of the pandemic, we'll all look back at the time and say, well, we did well. So it's about communication. Now, the second leg to it is this. If we've tried those measures, I mean, when I mean communication from the upper down to the grassroots, there has to be that communication. And like I said, in communication, in disease risk communication, we need to make sure that we send out information, we get a feedback from the people, analyze the feedback to know whether the people that we are talking to actually understood us. And when there is misinformation, we need to address it. Because sometimes some Nigerians actually want to listen, but there's a lot of misinformation making the rounds. Some people even say that if you are wearing the face mask, that there's something inside the face mask that can poison you in the long term. Yes, people have been saying that. There's even this vaccine hesitancy that we're talking about. It's because there are a lot of rumors. Some people say that there's something that will attach if you place a phone at the point.
Magnets there.
So we need to really invest a lot in awareness.
But if we flip the coin on the other hand, do you think there's also information overload where you've heard this thing over and over and over and over and over again that it is of no effect or impact anymore?
Exactly. That's a part of the pandemic fatigue that I talked about. Yes, everybody hears. In fact, people can actually sing, or rather, the children
read the lines.
Yes, they can read the lines. They can tell you, okay, is it not face mask,
washing of hands and social distancing,
and all of that. But again, I think we need to conscientize Nigerians. You know, we need to put some evidences. We need to put some message behind this and say, look, yes, you know the measures, but unfortunately, you might not feel the need to still do it. We need to make sure that we talk to these people and let them feel I feel that we need to, if you ask me, it has gone to the point that we need to practically tell people that people are dying. We need to use that message, because sometimes when you speak to people in a way, make it too shallow, they don't really let us tell people that people are dying. In fact, I want to see publications. I know this is being done, but let us see publications. Let us even probably tell to people, okay, in Lagos, so number of people died. In so number of people, not just say in Nigeria we had the so number of deaths. Yeah. Maybe that is Lagos.
It's putting it in perspective.
So the people say, so they are still dying in this Lagos that we are. You know, when people see things like, when they hear things like this, they'll say, well, this thing might just be true. Yeah. But if all efforts is proving abortive, I think we might actually want to still explore the option of a strict approach by making sure that we enforce it, because we need to be alive. So government is the responsibility of the government to keep Nigerians alive. So if we need to enforce it, we really have to enforce it.
All right, we have to leave it here now. Clinical pharmacist and public health expert Nsebase Kanem, thank you very much for talking to us.
Thank you.
And thank you for your insights.
Thank you so much.
Thank you.